So welcome. We are waiting to start in a few minutes. Welcome to the attendees and to all our panelists. We'll be starting at 6:30 in 1 minute. So I kindly ask the panelists, keep your mics muted. We are live also on Facebook. Those who can join Facebook Live. We are on the other side on Kenya Medical Association Facebook page. And we hope that we will be starting in 1 more minute. So be patient and we'll be on in a few minutes. So good afternoon, good evening, and good morning to wherever you are. This is Kenya Medical Association, the Physician Wellness Committee. We started off this partnership with Kenya Psychiatric Association and the Clinical Psychologist Association of Kenya in order to ensure we are providing the very necessary care that is needed by health workers and information that's needed by health workers to sort mental health issues that are being faced by most of the health workers in this country. We will be presenting today matters addressing child mental health amidst COVID. Most of us have children, others have been attending to children, and children have been asking lots of questions. We've had children plugged out of their normal routine, and most of them don't really understand what is going on during this season of the pandemic. And many of us don't have answers. We also are health workers who are really struggling at our workplaces. And sometimes you come home, you've got to self-quarantine or you've got to self-isolate, and children don't understand what this is all about. So we are privileged today to have two speakers, one from the Kenya Psychiatric Association and the chair of the Clinical Psychologist Association, Lisa Emba, and Judy Kamau, who are all children, who attend to children in terms of mental health. We also have a panel of specialists. We have Dr. Super, who's a pediatrician. We have Professor Atwoli, a renowned psychiatrist, with us. We have Sophia Mwirori, who's also a clinical psychologist, Yvonne Olanda. We have Ohas Josephine, who's a public health specialist and working in Nanyuki, and she'll be key in terms of matters public health and management. We have Edith Kuoba, who's a psychiatrist in Eldoret, and Dr. Gitao Catherine, who's a psychiatrist in Nairobi and also lecturing in Nairobi University. We have with us our president, Dr. Jacqueline Kitulu, who will also give a small presentation in terms of what's happening to children around the quarantine and isolations. And we also have, we'll be introducing others. I'll hand over to David to welcome our chair, Dr. Somba, who will say hello to the team. And then we move on to Dr. Jacqueline, who will also welcome us, and then we move to the speakers. As a part of housekeeping, we've got a panel at the bottom for the attendees. For the attendees, we'll kindly request that you put down your questions in the Q&A platform at the bottom there. If you're with us live, you can put down questions on the live feed on Facebook. And we will also throw out a poll just after our president makes remarks. And we want to know what, we'll keep bringing out a few polls that will also engage us as we move forward. Thank you. So I'll move it on to David to welcome Dr. Somba.
Yeah, good evening. My name is David Wairoto. I'm a consultant psychiatrist and vice CME coordinator, Kenya Psychiatric Association. Asanteni for taking part in our webinar. It's a very nice webinar. The topic I think is quite relevant. So I'll hand over to our chair, KMA Division of Physician Wellness, Dr. Somba. On to you, Daktari. Thank you.
Dr. Kitulu, you can take over. Dr. Somba will be joining us shortly. He's held up.
Okay. Thank you, Dr. Joy, and good evening, everyone. Thank you, Dr. Wairoto. Thank you, Joy. Thank you, KMA fraternity, and really the physician wellness team for ensuring that we are providing a resource to ourselves. Many times we are thinking about our patients. And at this point, it is important that we also think about ourselves as being the recipients of such help. So it's a fantastic linkage with the psychiatrists and with the psychologists as well. And we do hope that within such sessions, we'll provide ourselves with resources to cope with this time. Today we have a special session on children because we all have children. We are dealing with children and there are special needs that pop up. So we are hoping on a weekly basis we'll support each other and that will benefit from these sessions. Last time there was over 500 people and more who wanted to press subscribe and join in, and I'm sure they really missed out. So for those who are on, invite others who are not here and let's all learn together. Thank you, Joy, and thank you, the Physician Wellness team, for thinking about us as healthcare workers and our needs.
Thank you. Dr. Somba has logged in. Maybe he could say hello and then now we move on. So David, I think he's having challenge. We can
yes,
move
please.
on to the
I missed the, yes, please.
We can move on to the presentations.
Okay, so so our first presenter will be, I'll introduce all of them. Our presenters today are Dr. Judy Kamau. She's a consultant psychiatrist and a specialist in child and adolescent mental health. She's also a lecturer at the University of Nairobi, Department of Psychiatry, and also is in private time as a private practitioner. Our second presenter will be Liz Haemba. She's a clinical psychologist and learning specialist. Her specialty and expertise is working with children, adolescents, and the youth in providing learning and behavioral assessments, interventions, and various types of therapy. She has worked on several research projects with University of Nairobi and University of Washington, Seattle. She's a current chair of the Clinical Psychologists Association of Kenya. So we'll start with Judy. So on to you, Dr. Judy, for your presentation. Thank you.
Thank you very much, Dr. Wairoto. Sorry, yeah, just a minute. I don't know, can you see my screen now?
No, we can't see your screen. You have to do share screen.
Yeah, it's on share screen, sorry.
And then you put on as a slideshow.
Yeah. Okay, you may have to share mine then.
Let's try.
Yeah. Because you have it, so just you can project if mine is not coming on.
In the meantime, we can take a poll.
Yeah.
So we launched the poll to the members, child mental health amidst COVID. We want to know, has a child been anxious about COVID-19? Do click and tell us. So this goes to the attendees. You can click on your end.
Is it on now?
It's on now, Daktari. It's on.
Yeah. Okay. So good evening, all. I'll be talking to you about our children's mental health amidst this corona pandemic. I will start us off mostly to introduce the topic. Thereafter, Liz will carry on with the management. So this will be my outline. I'll talk briefly about stress and why the vulnerability during this period of corona virus, and then our children's reactions to stress, or things that you should be looking out for when someone or one of your children or adolescent has stress. And also I'll touch on a little bit about special populations and their needs. So just to continue, I think there's no one who really hasn't been affected by the the COVID-19 virus infection. It's come along with a lot of uncertainty, a lot of stress, unless you're living in a bubble. Although I did hear of a story of a couple who were out sailing for months and they did not get any news about the corona pandemic until they came to shore, and they were just all shocked about what had changed in these restrictions. So it's affected everyone, and mostly due to the restrictions that have been put in place to curtail its mitigation, and also because of its mode of transmission, and also the accompanying mortality and morbidity that it comes with. So for these reasons, it's really affected our day-to-day activities. And what is this stress we're talking about? So really, stress just means a biological or psychological response that's usually experienced by us when we're encountering a threat that we feel that we're not really sure how to, deal with. And most of the time, children's not spared. We react in a way that mobilizes our biological or psychological resources to enable to manage a stressor. In this case, the stressor being the COVID-19. It's been a big source of stress, okay? And then, so we're not just, the way we usually simplify stress and fight or flight responses. So this comes along with a whole system interaction, including the limbic system, which controls emotions, controls our memories, affects our mood, and then also shapes attention. We also have the dopamine system that can be affected, which also affects our mood, adrenergic system, stress signaling, the norepinephrine, epinephrine system. When the stress is also comes into a chronic stage, then we do have activation of the hypothalamic pituitary adrenal axis, and also serotonin system, endogenous system, and as a result, especially with the HPA axis being affected, also our immune system is affected because of the cortisol pathway that's usually activated. So when we have stress or when we encounter stress, a lot happens to our body. And most of the time, yes, people can deal or be able to cope with some stresses, but sometimes it comes to affect us in such a way that we may need that extra help to manage our stresses. So just to highlight how much stress or how much COVID-19 has affected our day-to-days. So the chart that you can see, these concentric circles that you can see, it talks about the ecological theory that was brought about by a gentleman called Yuri Bronfenbrenner, which basically just looks at, especially for children, the interaction between the individual and their environment and how they're affected by their environment. So we can see the individual being the center place, that's the child. And then the microsystem, the mesosystem. So when we're looking at the COVID-19, we look at it from the outermost concentric of rings. So many things have come across and have come down to affect or trickle down effect to the individual. So we're looking at, our cultural beliefs, our customs, you'd go and visit and even hug your grandmother. Currently, you can't even do that, yeah? So that's really affecting our day-to-day. And then back on, then the schools and the community services, parental workplaces have been affected. Your parents can't go to work as they used to. Your income is affected. Your school is not available. Media is not, you throw all sorts of things at your child. Then of course the other, the immediate, from the indirect environment to the immediate environment. So this has affected all the individual who is the child in all sorts of ways. From their neighborhood, they can't go out and play. The schools have been shut down. The home front may have a lot of stressors going on. The immediate family, their parents can't even go to work or even access transport to go. So this has affected us. From the trickle-down effect from this virus comes down all the way down to the individual in its effects. So looking more or less breaking down those concentric circles, we're going to look at what are the sources of vulnerability, or what makes the child more vulnerable to mental health problems during this period of COVID-19. So there are various factors that come into play. Again, vulnerabilities vary from child to child. So and we also look at our genetic makeups and also the environment that the child is in. So not all children will be greatly affected or greatly stressed out, but some will be greatly stressed out. So people have different sources, different ways that they can build their resilience, but some have to be helped along. So why are our children more vulnerable during mental health, with mental health issues? Isolation in itself. Currently, with schools being out, staying at home, children are also in isolation. Yes, you might be just with your family, but you used to have, be able to go out and play, be able to interact with your friends, but now you're in more of an isolated state. That makes you more vulnerable. There's interrupted school, and it is a source of stress. Think about our candidates. They're wondering, just the other day, someone told me, was starting to now start hypothesizing for the government. We might all have to repeat a whole year. We may all have to, so this is also creating a stress. There's a lot of, investment has been done already. And for this child now to be told, oh, you can't finish, or you have interrupted school, so your preparedness for a final exam, that is also a source of stress. There's also the lack of physical activity, which actually for most of us, when we're treating mental health problems, we encourage physical activity, but this is also lacking. There's a lot of fear and worry about, people's health and that of their loved ones. Most of us who are listening are medics, and every time you leave your house, someone will yell, don't bring for us corona. So that it's not just sometimes safe, they're also worried. What if my mother goes out there, and not even just those who are working in medical professions, those who just leave the house. You've heard of people leaving their house and not coming back. So there's a lot of fear and worry about their parents or their loved ones' health. They can't go and visit their grandparents because they might be possible carriers. So that might be a problem. For some of our children and adolescents out there, school is a safety net. And many of these pupils have lost the safest spaces that they know. Maybe they were prone to abuse where they used to live, or they used to know school is where they'll get their one meal. Maybe they have hot lunches provided. And they've also ended up having some losing their social support systems, their teachers who they used to confide in, used to talk to, their friends who were in school that they would call, they would socialize with, they'd play games with, they'd have lunch with. That has been cut off. That makes someone more and more vulnerable to mental health problems because you've lost your social support. There is parental stress and anxiety. Now, children and adolescents are sponges. Even children at the age of 2 are sponges. They thrive off their parents' energy, and they can feel if their parent is stressed or is very anxious. So when you as a parent are stressed out and are anxious, your child is bound to feel it. Or the effects of the stress will trickle down either through hushed or raised voices, feeling unappreciated, being picked on very small things. The stress from the parent trickles down to the anxiety, and we cannot say that parents haven't been stressed in this COVID-19 pandemic. There's financial stressors, there's loneliness, there's isolation also for the parents. And also in isolation, they're more vulnerable to abuse and trauma. Yes? Sorry. Yeah, they're more vulnerable to abuse and trauma. So isolation, think about isolation in an already abusive environment, or isolation in a newly abusive environment. So there are some who never used to be abused before, but then now they'll start being abusive. And that makes them more vulnerable to mental health problems. There's also fear and stigma. You don't want to even cough in public at the moment. That is also a source of stress. There's access of services has been disrupted. Treatment has been disrupted. Children who used to go continuously for care are no longer going for care. So that is a source of stress. There's worsening of chronic health problems. Children who maybe had asthma and they cannot access their care, that is a source of stress. So even the more vulnerable to mental health problems are those who come from low socioeconomic stratas, whose parents have mental health problems, those who have pre-existing mental health problems, and those infected, those exposed, and those under quarantine. There's a lot of being cornered, especially for those who are exposed. If you think about how individuals are being looked at or being identified with once they're suspected to have been infected, that is also stressful to the child. Okay. So how does stress manifest? How would you have an idea that your child is stressed or your child is going through something? So this is in general. This particular slide just highlights in general for various children. So they might have excessive crying, irritation, they might regress to their old habits, might have stomach sucking, or some may start bedwetting. They may have excessive worry or sadness. So you may actually see that your child is sad. They may start having unhealthy eating habits or sleeping habits. Either they are barely sleeping or they are barely eating too much, although I think that has become because out of boredom as well. There's irritability and acting out. Yes, there's also poor school performance. There's avoiding of school, and yes, even online schooling. We're seeing children who are refusing to go to attend their online classes. There's poor concentration. They avoid activities enjoyed in the past. Maybe they play board games as a family, but you see this person is isolating themselves. They would even, interact with their friends on media, but that's no longer happening. They may have unexplained headaches, body pains. They may turn to alcohol, tobacco, and other substances. So these are just some of the signs of stress that we have. But if you look at it by age, so I'm doing this so that you can see it doesn't just happen to adolescents. Even infants may actually currently, there's a lot of talk about infant mental health. So for infants, they may sap off their caregivers' energy, may cry for no apparent reason. You find toddlers with, up to 2 years not playing even with their toys, they just get withdrawn. For about 5 years old, there's repression, thumb sucking. You start getting more bedwetting accidents. There's fear of illness. Suddenly they start fearing strangers. Monsters are now appearing more. They fear the dark. They become even more clingy to their caregivers. So those are some of the signs of stress by age. They change their eating habits. They have an unexplained weight, and then they also have behavioral change. They may be more aggressive, more withdrawn. They may have hyperactivity, speech difficulties. They may start stuttering or become mute or just become disobedient. For about 6 to 10 years, they're similar ages to those above, but also mood is especially more noticeable. For younger children, you may always think terrible too or something like that. Others may have aggression for no specific reason, but also 6 to 10 years, you see regressive behavior. Someone now wants to be fed. They used to feed themselves. They don't want to dress themselves. And they used to be able to do these things very well. It might be a bit tricky, especially when looking at teens, where you see physical and emotional changes, which you're not sure, maybe they're due to their stages of development, but sometimes they're usually above board. They may have difficulties coming the news of the epidemic, and sometimes they just have denial reactions. They don't reach out. They will say, I'm fine, or whatever questions you ask, it will be silenced. They may have physical pains all the time. So also for this COVID-19 pandemic, what I mentioned is for those who are especially vulnerable are those who already have pre-existing conditions. And I thought it would be nice to look at how those pre-existing conditions have been affected by whatever is going on at the moment. So we have many children who either start newly experiencing anxiety or they have been anxious. So for many will wonder, what is all this anxiety we're always talking about? So anxiety really is just an unpleasant feeling of apprehension, which can be accompanied by the physiological or cognitive or behavioral changes. So where you have maybe poor concentrations, you may have palpitations may come up, sweating, behavioral processes where you may be more restless, or even in addition to cognitive feelings, more fearful. So that's basically anxiety. And in children and adolescents, we talk about more of separation anxiety disorder, where the child gets very anxious every time their caretaker leaves, or they see as if they'll be separated from their caretaker, where they feel maybe something bad might happen to their caretaker, or they will not see their caretakers again. And this, we're not talking about those very young 9-month babies who cling to their caregivers. So here we're talking about even 5-year-olds, 7-year-olds who have problems with their caregivers being away from them. We have generalized anxiety, where the person is always worrying about everything and nothing all the time. Worry about their parents' well-being, their friends' well-being. Their mind always never rests. Or we have panic disorder, which presents with panic attacks, and also simple phobias. So with all this uncertainty that's happening there and the threat of infections, this can exacerbate pre-existing anxiety. So if a child is already anxious, they might even get more and more anxious, and which will need to be looked after. Depression. Depression mostly it's a condition where someone has low mood. This affects children and adolescents as well, not just adults. Very low mood, loss of interest in activities that used to catch their interest. They want to keep to themselves. They have very low energy. They may sleep a lot or not sleep at all. Their grades might drop as a result. So for this, it will become more difficult, especially for mental health practitioners, because most of the time we emphasize on physical activity and social connectedness. With this disruption, there comes now isolation and loneliness. Now, this person who is depressed even can sink further into their depression. We have obsessive compulsive disorder. When someone is stressed, the obsessions and compulsions become worse due to stress. And if someone who has obsessions related especially to death, to dirt or contamination, this actually amplifies their fears in those who have obsessive compulsive disorder, and actually justifies more of their compulsions that they end up having to do. We have tic disorders, which can be exacerbated. So tic is where you have an involuntary muscle movements that wax and wane when someone either with stress or not. So you may find children who have mental health problems or who are being treated even for tics, even while on treatment. Stress can exacerbate the frequency of their tics. So this can worsen. Attention deficit hyperactivity disorder. So imagine a child who has hyperactivity and is just in a small restricted place, no channeling for extracurricular activity, whether it's music or sports. And in that confined space, it becomes very difficult for the child and for the parent. They get very disorganized, especially with the lack of structure that is usually there in school. So you might find even while they're on medication, they seem as if they're fragmenting even more. So this is something to watch out for, especially with lack of structure. Yeah, because now it presents as if the child is on one very long holiday, even if they have to do their day-to-day activities. Those children who have autism spectrum disorder, they thrive on routines. Yeah, so the routine is interrupted. They are confined in one space. They may be overstimulated. They're in a small room. The television is always on. There's always activity. People are always walking around from morning to evening. This child can either even present with a bit of with some aggression or irritability. Self-injurious behavior may come up because they're off their comfort zone. And some of these things we can't, they can't quite cope with. And that's not just for even many other mental health problems. Now, also of note is that there's no because of all the fear that's been there and all the restrictions in movement, access to care is very difficult. So someone who even has usual regular appointments ends up missing their appointments because they don't want to go to hospital. They don't want to be caught up in curfew. Even when you tell, they know they can get maybe a pass to come and see you, they don't want to risk that. Currently, there's a lot of financial implications. So people are not coming for care. So they are not even coming for specialist care. So most of them would be coming either to see their pediatrician or be interacting with a pediatrician somewhere, or they'll be interacting with a general practitioner or even their nurse, or even just interacting with the clinical officer. So many of these children may not have access to specialist care, especially at this time of COVID-19. And it's important, at least for other clinicians who have more access to those, especially to primary care providers, to have an awareness of mental health problems that might be happening, that might affect children and adolescents. So, and also how to deal with it. So on that note, I will leave it to Liz Khaemba, who will also now take us through management and strategies that are helpful in maintaining the well-being of these children and also promoting their resilience. So that's it from my side. Yes. Okay.
Thank you very much, Judy. That was very insightful. From the Q&A, we will be asking questions after Lisa Hemba goes through. Since Q&A questions are coming in, we are trying to shift them, and we'll have a deliberation after Liz goes. So David, you can introduce Liz.
Okay. All right, good evening again. So I'll introduce Liz Haemba. She's our next speaker. She's a clinical psychologist and learning specialist. Her specialty and expertise is working with children and adolescents and the youth in providing learning and behavioral assessments, interventions, and various types of therapy. She has worked on several research projects, University of Nairobi and University of Washington. She is current chair of Clinical Psychologists Association of Kenya. So welcome, Madam Liz.
Can we unmute, please?
I have, David, will you project my presentation, please?
Just a minute.
Thank you.
In the meantime, Judy, probably you could answer this question. For children who seem okay and aware of what is happening and appear happy less than 5 years, should we be worried? I think I heard you say something about that. You can think about it and then I will answer it during the Q&A since Liz's presentation is up and running. Welcome, Liz.
Thank you so much. Thank you, Dr. Kamau, for your good presentation. I have taken 2 of your slides just to act as a reminder for us as we talk about management strategies and excuse me, maintaining well-being and promoting resilience. So one thing we have learned is that children are not small adults. They're a special population. And they need a little more special care than just adults. We realize that they don't have the skills to articulate their grief, their loss, whatever it is they're facing during this time. And we realize also that they don't know how to identify themselves anymore. Just like us, we are having difficulties with identifying, because when we meet a new person, one of the first topics of conversation is about what we do, whether you're a doctor, a therapist, a lawyer, or a stay-at-home mom. Many of us find that our identities and careers are intertwined, and children are not different. So as Dr. Kamau says, there are vulnerabilities, there are things like issues like isolation, lack of play with peers, fear and worry about health, the health of their loved ones and their own health, loss of access to their support systems, loss of parental comforts, because now parents are no longer the people they thought they were or the people they expect them to be. And of course, there is the exposure to trauma, and abuse during this particular time. And with that, then we find that there's a lot of loss that is going on and a lot of grief, just like for each and every one of us. We've had a lot of loss of roles and responsibilities. And we all know, I think, the processes of grief and what we have gone through and what some of our children, especially the older ones, may be going through, where there's denial. And at first, of course, we didn't think it was serious. Children were very happy to be home and away from school. And then you realize, wow, this is not ending. I'm home now and I don't know what to do. So you go into anger and you're wondering, why am I not being allowed to see my friends? Why can't I visit? Why can't we go out for lunch like we do maybe on Sundays or on special days? And we get to the process of bargaining. So we are telling ourselves, so if I wash my hands, if I wear my mask, this will end soon. And the children realize it really is not ending as soon as they thought. And a lot of the children, especially the teenagers, they go into depression, some of them, especially where the parent insists you have to spend time at home. You can't go out and visit your friends. You can't go to school and see your favorite teacher, etc., etc. And we are trying to get our children to the place of acceptance where we and they learn that they can play their part and do what they can do in their own capacity. Wash your hands, sanitize, stay home, wear your mask if you have to go out briefly, yeah, and realize that the loss is not total. You can still talk to your friends on the phone. You can still do your schoolwork. You can still interact even with your teacher should you need to. So once we reach this place where we accept that we have that there is something we can do, both us and the children, then it becomes better. But let me go immediately into talking about what we can do to help the children. Daktari said that, please go to the next slide. The common reactions during this period would include excessive crying and irritation, excessive worry or sadness, unhealthy eating habits, but children also react differently according to their developmental level. So we'll talk maybe a little bit about babies and toddlers and supporting those. We've learned that right from that point, we see that the babies actually react to the changes that are taking place, because as Dr. Kamau said, children feed off our energy. You'll find babies right now, some of the common reactions, they're irritable, they cry more, they become a bit more clingy, less active. Some babies may even lose weight. Some may be jumpy, some may be fretful and distressed. You find that sometimes when the parent is at home, either maybe is a healthcare worker who's come back from work and you're not self-isolating, then you want to hold your baby more and your baby realizes that things are not going well. So what can we do to support the babies and the toddlers? Routines are key. And routines, we take them a little bit for granted, but a routine gives a toddler and an infant a sense of security. So if you had already started supporting your baby by creating a sleeping program where they sleep during these times, are awake and fed during these times, those routines need to continue, even though maybe you may be home a little more or a little less. Yeah. So routines give children, give toddlers a safe and secure environment. Young children understand how life works, everyday events, procedures, and they learn also what is expected of them when their environments are more predictable. So routines are very important. Children who are fussy will need a little more holding, a little more cuddling. We need to manage our emotions enough so that we are calm around them. We provide them with the items they need, like those who are already at a place where they know their comfort items, that those are available to them. We also have to make sure in our context that we have a good caregivers for them when we are away. We might be away for a little longer during this period, and we need to ensure that they're comfortable and they're okay. Their needs, and especially the extra needs, are taken care of. So I just separated that after toddlers 4 to 6 years old, just so you can see that children may react differently. Again, not all children have these reactions, but a lot of children do have the reactions, there's a lot of things have changed. So children may also change. So there's fearfulness, anxiety. Children withdraw, they're quiet. Sometimes they may show a lack of response when you ask them, are you okay? You know, they may be afraid. Children may change, their eating habits may change. They may want to eat a little more. They may eat a little less. There may be difficulty in sleeping. Again, toileting problems, even for children who had already been potty trained, that may happen. And there may be some regressing, you know, for a 4-year-old who now wants to crawl, or who wants now a bottle, just something that comforts them. That may happen. So what do we do for these children? Again, routines are bay, as the young people like to say. They're very, very important. You have to, with this age group, you need to teach them how to use their words to describe their feelings, because these feelings sometimes really confuse them. So tell them, you know, that they are sad, and you know that they're not feeling good. Reassure them of their safety. Reassure them that even when you leave, there is somebody who loves them, who cares for them, who's looking after them. Hugs and cuddles, hold their hands and just encourage them. Again, speak calmly and gently. This is repeated basically through all the age groups, because right now, because we are also going through a lot of issues ourselves, it may sometimes be a bit difficult to be calm. Again, provide comfort items and encourage play. Remember, children use play to help them process what is happening in their surroundings. So if you can be able to make a small sandpit, if you can be able to give them puppets and play a game of this is my friend, you know, if you can be able to give dolls, you can write or draw, you know, this is very, very important. And also some physical activities, you know, like have a dance session at home that helps also to relax them and helps to relieve some of their stress. So 7 to 12-year-olds are also in a different developmental stage. And with this age, you might find they're easily distracted, they're forgetful, they're anxious. They may also have increased fears. You may find now new fears of the dark at night. They want the light on. They may also be a bit clingy. You may find they're sitting next to you more and more, or they may just be quiet. This is where also you start finding the physical complaints. You will hear maybe, "Mommy, I have a tummy ache, I have a headache," or they're a little more irritable. They may have tantrums. If you have several children, you may find that they're fighting a lot. Or some of them actually start being quite defiant. You know, they refuse to do what they're told. and they may also start becoming a bit aggressive. So this all will need to be managed. Like the other children, there may also be changes in eating and sleeping habits. There may be those oops moments where there's secondary enuresis, there's renewed bedwetting. They may even have some problems, soil themselves sometimes during the day. So all this we will need to, to address. And how do we help this age group? We reassure them, reassure them. Also ensure that they're with somebody who they feel comfortable with and they feel safe with, allow questions from them, because this is the age group where they will ask you, so mommy, now that you're going to work, what happens when you come back? If you bring COVID to us, then what happens to us? So you have to provide honest answers. You have to provide honest answers. I go into work and I wear my PPE and I'm protected and I'm safe and I keep myself clean. And when I come home, maybe I disrobe and wash and clean and, just provide them with honest answers to their questions. Again, this hugs, cuddles, holding hands, this goes throughout a child's, throughout childhood. We'll even do it with the adolescents. Speak calmly and gently again. Encourage also play. This is still the age where children are playing. Maybe not with the younger things, but with the younger children's stuff, but they're also playing. They like drawing, they like art, and physical activities that are of an age appropriate level. So I just thought I would also just mention these preteens, the adolescents. And we find the adolescents can be especially anxious about the safety of the family and friends, and even about their own safety. This age group will try to please. You might find you go home, you find they're the ones who cooked, they don't want you, they don't want you to worry. Their reactions, usually the emotional reactions, are much stronger. They feel them much stronger. They may feel anger, they may feel a sense of guilt, they may feel also a sense of rejection. So some of them will want to take on a little more adult responsibilities, and sometimes the way they process their emotions is they want to just try and please the caregivers or the parents. They also become more focused on what's happening, and this age group will ask questions. So they think, they may even dream, and they may want to talk about COVID-19 more often to you and to others. So what can you do? Take the time to talk to them. They need you, they need reassurance. So and reassurance can happen in several ways. You can speak and tell them, no, we are doing the best that we can right now. And also physical touch. Once again, the hugs, the pats on the back when they do these good things. Be honest about what is going on and about your feelings and their feelings. Encourage them regularly. And even when you see them behaving like little adults, please allow them to be children. Don't expect that they will now take over these adult roles. So we'll talk a little bit about adolescence. Now, this is a very sensitive age, and a lot of parents, once the adolescents are like maybe 18, 17, 18, 19, they can get fairly aggressive, and sometimes we get a little bit scared of them, and because we don't know what's happening with these changes, But we find that some of their reactions, especially during this period or this kind of situation, they may be quite easily distracted, forgetful. They may have difficulty concentrating, and mostly these are the ones who may refuse actually to attend school, even online school. They may be overwhelmed by their reactions, which is anger, guilt, or fear. They may have a difficulty expressing their emotions. Sometimes when you ask them something, they'll just go, I'm okay, and they don't really say what's happening to them. So they may have increased fears about other safety and also their own. They may want to be near family or friends, but also this age group may also be more of the risk takers. So they may be a bit difficult to complain. I remember we were talking in one of our meetings on this forum with, and we were talking about adolescents and how sometimes it may be difficult to contain them in the house. So they may have physical complaints also. This is the age group more likely to become irritable, defiant, antisocial, and even display aggression. So as I said, they have a fair amount of risk-taking behavior. So you might find this is the point where they start drinking, they will start taking drugs, or they will start having sexual contact. And if your adolescent is driving, they may also take the car and just misuse it. So we want to check. Also, you might find they may use jokes and humor to mask their feelings. But some of them may want to take on more adult responsibility. And here in this age group, isolation is quite a big deal because of their, at this point, adolescents really need to be socializing with their peers. Yeah. So we need to be careful how we handle them. Yeah. Next slide. So how do we support them? We support them.
How would you like to change this along?
Please move to the next slide. So how will we support them? Be honest and let them know what's happening. Talk to them and listen to them. Some of them may say things we find ridiculous, but just give them an ear. Talk to them, help them to process what they're feeling. If it's fear, if it is sadness, again, just be sure that you name these feelings and so they can identify. Normalize their feelings because a lot of us feel the same. We are also just as afraid about the situation, but reassure them that they are safe and try again to keep routine and normal activities going on. But with adolescents, we have to talk to them also specifically about loss, because this is a great teaching opportunity. And we know that although we have lost a lot of opportunities, a lot of our friends, our interactions, and temporarily, they are not immediately available to us, but we can help them learn that in life, just as many of us have seen, there are very many losses, and learn how to deal basically with these losses. Yeah. Again, avoid expectations of adult behavior. These are in between children and adults, so we don't expect them to be adults. Give them ideas of things they could do, like physical activities, music, talk with friends, allow questions, and these ones are at the age where you can give them honest answers. Just don't catastrophize with them. Yeah. Most important, discuss the rules with the adolescents. Discuss the rules, emphasize, because they don't understand how important, they may not understand how important this is, because the teenagers usually feel quite invincible. And they say this is one thing they learned very early, that COVID-19 is not as problematic, although we have seen that a lot of adolescents also get infected. So when you're talking to them about social distancing, talk to them about asymptomatic carriers. Talk to them that they could actually bring it home if they are asymptomatic, and they can't be sure about their friends also. Yeah, but remember that bonding is a very important part of this period. So you might have to give a little bit. Yeah. So understand their frustration over not seeing their friends. Validate their feelings, discuss how it can be made more bearable, for example, by loosening a bit of the rules on time spent on social media, just to enable them to socialize. Remember, this is the time they are learning how to interact, how they will behave in their adult life as they socialize with their friends. So since they can't do it physically, just be a little bit more lax about helping them. So again, support remote schooling, because sometimes you find parents themselves do not talk very positively about what is going on with school. They talk a bit about the teachers, not in a very positive way. Support schooling, create these schedules together to attend the Zoom classes or WhatsApp, to do the lessons that the teachers have sent on WhatsApp. And make sure you tell them that we do not get the reward before we do the work. Yeah. So if you want to rest, or if you want to spend time on the phone, you have to work first, and then you can rest. Yeah. So again, for adolescents and all of us, actually, sleep is very, very important. So it helps with the positive attitudes. It helps also with the ability to fulfill their academic expectations. And we have to make sure that we are also giving them healthy meals, yeah, and trying to create a routine for them also. So we have, although a bit flexible, but we have sleeping times that are a good times for them, because then they can be able to focus. Remember, when young people lose routine, there's a lot of stress. There might be some anxiety, and there might be some depression. So validate their disappointment. Remember, this is a time of so many losses. So give them the room to share their feelings and listen without judging them. Reassure them, or don't reassure them that everything is going to be okay now, but at least help them to know that the situation is being handled. Acknowledge that they are stressed, and acknowledge the real stress that they may be under. Don't downplay it, because of this developmental stage is also quite sensitive. Express confidence in them that they have the ability to rebound. When all this ends, they will rebound, yeah? Teach them about radical acceptance. You know, it means that we feel bad, but we sit with our emotions and we don't fight our emotions, yeah? It's okay to feel anxious. It's okay to feel scared. It's okay to feel angry. Yeah. So, but we ask ourselves then, what can we do right now? What can we do? This is a discussion you could even have in a family group setting. And the answering of this question of what can we do right now, it also gives us power, especially when we involve the children. So a little bit about the children with intense needs, as Daktari has just said: ADHD, autism, mental health difficulties. So that study there shows that parents of these children are more likely to develop anxiety, depression, insomnia, and even marital problems themselves, yeah? So we need to also really, really care about these children. So accept your limits. If you have a child who has these special needs, accept that what you can do right now and what you can't. Call out your social support system. That's very important, especially for healthcare workers. Right now, we're working really hard days, and by the time you go home, you're really tired. So if you have somebody who can help you, that's even better. If you can be able to increase help at home, that is even better. For example, get somebody else into the home who can help a little more, so also you can get rest. New routines may need to be created because now there is no school, and this may require a bit of patience on the part of the transition from the old to the new routine. And during this time, because some of these children are in school and they have a very structured day, communicate with the teachers and the other carers at the school. And some of those strategies that are used at the school, you can actually use them at home. And when things don't seem to be working, please seek out professional help or intervention. Don't try to be a super mom or a super dad during this time. COVID-19 and perfection kind of doesn't go together, so we need to be very, very aware of that. And most important, if you're not happy or you're not healthy yourself, then your child is not going to be having a good time. Yeah. So as we've said, we keep those routines in place. We try to incorporate new activities so that whether you're home or not, the children are occupied and they are not worrying. For example, you can put in some evening game time, some story time, a daily walk or bike around, you know, family time with gym and aerobics on from the TV, or yoga time, you know, just put in new things that reassure but also relax the child. When you're anxious yourself, take some time out. Yeah, take some time out, step back, take a break, maybe go even to your bedroom, relax for a bit, and then come back. Yeah, watch out for catastrophic thinking. You know, a lot of us catastrophize. We think of the worst possible scenario, and some of this obviously it reflects on how we behave with our children, and the children catch it. Yeah, so as we said, manage your own anxiety. When anxious, take this time out. Yeah, take care of yourself, because if you're a happy parent, then your children are happy. Build what we call stress tolerance. Yeah, pay attention to how you're feeling. Check what are your priorities. Do you really need to be doing some of the things you're doing now, or can they be done later? Yeah, avoid being hijacked. You know, sometimes your emotions can get the better of you. So calm yourself down by thinking a bit more realistically. If you find you're unable to do so, call somebody and just tell them how you feel. Call somebody who can really help you, and they'll help sometimes bring your emotions back in check. Don't do too many things, otherwise you get overwhelmed. Take some time out if you need to. Talk positive. You know, when you talk positive, also your children are listening, and they feel a bit better. Get some of these people out of your life. You know, there are some people who don't really bring good vibes with them. Put them on pause and pick them up once all this thing is over. Yeah, because your health, your child's mental health are very closely linked. Again, reach out for your social support system. Make plans. I found that one thing that I do for me is I make plans like for travel, you know, in the future. I make plans. I ask my son to make plans. I have a teenager, so I'm also in that role, in that place of adolescence. So sometimes I'll ask my son, let's make a plan for what we are going to eat the whole of this week. Yeah. Do duty rotas. If you have several children, who is going to do this today and who is going to do this tomorrow? It gives not only hope, but it gives a sense of feeling good also. And lastly, make time for yourself. As a parent, as a healthcare worker, you need to have some time. So this may be small, few minutes, like just shower or bath time, just taking a walk around your block, like a little bit of reading time or a little bit of TV time, when it's just time that is there for you. Be thoughtful, be intentional, eat well, get enough sleep. Don't put too much pressure on yourself. As I said, perfectionism and COVID-19 just don't see eye to eye. Yeah, give yourself grace when you cannot meet your expectations. When you go home and you find the house is upside down, you know, don't try not to get upset, try not to yell. Know that these children are home. It's not like when they go to school and they come back and they're tired. So be realistic and set boundaries for yourself. Don't absorb other people's fears and anxieties. This worst case scenario people are not good for you right now. Those people who send those anxiety provoking texts, those doomsday sayers, try to avoid them. You can try also, as you're practicing social distancing, also to practice emotional distancing from these people. So I think that's basically all I have to say for today. So I'll take it back to Dr. David.
Thank you very much, Liz. That was very insightful. We'll move on to our discussion as well as take the Q&As. David will start with the first question, which will be directed to Judy. And then we move on. David?
Okay, thank you, Liz, for the wonderful presentation. So for Dr. Judy, the first question is, how do you prepare a candidate for KCPE, who was recently diagnosed with depression and is still trying to get better, and the pandemic is not making it easy. This is a certain lady from email. Question to you, Dr.
Okay, thank you. So as we've highlighted in our presentations or in our previous talk, so this young lady actually has two things going on. Okay, actually even more than two things going on. She does have the depression that she was diagnosed with. She does have a stressful event coming on soon. So she's preparing for major exams. And then on top of that, she has to isolate and limit her connectedness, which would have been part of her treatment. Number one, I would say, especially since there has been already a diagnosis of the depression, that would be the primary to manage that. Because if we are not able to manage the depression in the first place, this young lady will not be able to study for her exam, focus, or even be able to do self-care routines that we are advocating during this COVID-19 period. So if she's already seeing someone for the depression to continue, if she's still feeling like she's struggling, then she can also communicate this with her mental health provider that she's still struggling. And then all the other things that Elizabeth has mentioned about self-care, then should also be able to apply. They're taking, taking scheduled breaks, not getting fully out there, but introducing small activities bit by bit. That would really be helpful. So for her, would manage the depression, at least optimize her care for that, as we are also enabling her with support. Of course, I'm hoping with support from her parents or from her other social supports, should also be really involved in her care to also ensure that she's also doing the self-care routines that she's supposed to. Because unfortunately, when people are depressed, when, especially in this period, when we want you to, at least be awake, be a little bit active, it gives you leeway to even spend the whole day in bed, socially isolate even further, even in your depressive state. So involving the parents or her social support in terms of ensuring that she's also looking a little bit after herself. The pressure, of course, for exams will come in, especially in our setting where that is usually more priority, unfortunately, than even for someone's health. We've seen that a lot happening. So that can take a little backseat, not entirely backseat, because she still have to incorporate a little bit of activity as she's getting well and looking, as the depression is being managed.
Thank you very much, Judy. We'll take another question here from Vanessa Kethioma, who asks, please comment on online mental health services. Are they effective? How can the interactions or sessions be optimized? The same question has been asked by another attendee who asks what systems are being used, because I've tried, but I'm only getting video calls from the US mainly, not Kenya. So I direct this question to Professor Lukoya Atwoli, who will highlight a few things that are happening even on the ground so that we understand what the benefit is even with the online mental health services and how to optimize on it. Welcome, Professor Atwoli.
Thank you. Thank you, Joy. And I want to, first of all, take this opportunity to thank Judy and Liz for brilliant presentations that have really, really tackled this subject so well that I do not expect that any one of us will have much to add at the end. Thank you very much for very well prepared presentations. As for online mental health services, I think you have to think about mental health needs along a continuum. There are certain things, like if you have some anxiety related to COVID-19, if you have questions about some of your children's behavior and so on, it is possible to call a provider and have a chat on the phone and address those issues, and you can go on with your life without much of a problem. So for people with mild to moderate anxiety, even a phone consultation would be able to allay a lot of that. As people who have continuing, who have had pre-existing mental illnesses and have been on continuing care, again, arrangements could be made to have either a phone conversation or a video call such as this, or even sometimes an email conversation through a secure platform where you can share information with them about how to continue with their care, where to get their medication, perhaps even send a prescription that they can present to a pharmacy and they get care. So that is still a way of getting care online or through digital platforms. The bigger challenge is with people who develop new problems now, or who have exacerbations of existing mental illness that will require a lot more than just a conversation. And so those, you have to have an arrangement where continuing care can still be provided face-to-face. At the moment, I'm aware that there are quite a number of counselors and clinical psychologists who have been offering care through online platforms. A lot of it is what I described in the mild to moderate range, where people just need somebody to speak to, people need a shoulder to lean on, people need to have some reassurance. That can happen online. We can even deliver cognitive behavioral therapy in a patient who has been properly worked up and a patient who has been properly prepared. There are online platforms where they can get more specialized treatments like cognitive behavioral therapy and other types of psychotherapy. So that is possible. And all we know now, as far as we know, it works if delivered by a person who's properly skilled, notwithstanding the platform. But it doesn't work for everyone. There are certain people who have access to these platforms, people who have been adequately prepared, who would benefit from this kind of care. So there's an entire spectrum, and depending on the need that somebody has, they might be able to benefit from some of these online deliveries. One last thing that I will say is that COVID-19 is going to compel us, mental health providers, to think a lot more deeply about those digital platforms that we have been, we have been very ambivalent about them. We are going to have to think a little more deeply about how best to deliver care through those digital platforms for people who can benefit from them, so that we leave only a small percentage that will require actual face-to-face interventions in hospitals and clinics. I hope I have attempted to address that.
Thank you very much, Prof. Very well articulated. And we look forward to the new normal that we are currently having, and better access to mental health care using the technology that's already available. So David, you take up the next question to Judy.
So the next question is for Dr. Judy Kamau. So the question is, any insights on how to get a 4-year-old to understand that even we adults are not sure when the pandemic will be over, and that his school is still closed till further notice?
Okay, that's a good question. Number one, I think answer to the best of your ability for that age. And don't get tired of even answering the same question over and over and over. Just to recall, even before the COVID-19, around the age 4, they might answer this, they might ask you the same question over and over and over. Think about taking a road trip with a child that age. You'll never reach. So even for this young child, reassure and just keep answering that you're not sure when they're opening, but they will open soon. And the government is doing the best they can. But I think most of the time we try and get, as Liz said, information that is directly relatable to you. Don't get information applicable to the United States and it's not applicable to Kenya. So the Ministry of Health is offering guidelines that are applicable to us. So the same answers, you would also translate them to a young child of that age. So even for them, just keep reassuring them and answer to the best And don't get tired of answering the same question. Don't get irritable. The more you get anxious, they also feed off the anxiety. So just calmly, each time they ask, just reassure them and answer to the best of what you know. So don't make up information, actually.
Thank you so much, Judy. We'll take the next question to Liz Ahemba. One of our attendees has asked, is there any art therapy in the country, and how do we help our children cope up with that? And I would say back here, that's one of my daughter's arts, and she did it just to help tide over this time that we are going through a hard time. And I told her, draw the sunshine as it sees through the window, what you see from there. And she something that she can handle sunshine. And that's my sunshine. It stays there whenever I have meetings and I see it, and it brings at least some uplifting thing. So what are we doing in terms of art therapy for the panelists? Judy, can you
You're breaking up, I think. Liz,
You're breaking up.
We can't
Yes.
get the question.
I think the question was, is there any art therapy in Kenya?
Yes. Yes, we have art therapists in Kenya. We have most people who work with children from a psychological, maybe psychiatric also perspective, have actually one of the therapies that we use with children, especially who cannot, because children have difficulty articulating, we use art as a therapy. So yes, there are art therapists in Kenya, and I'm sure they're available if we really do search for them. There may be someone from Clinical Psychology Association of Kenya. If you check on our website, you'll find the whole list of our psychologists who are in our association, and you may find actually some who work with children and are registered as art therapists.
May I ask a question? Hello.
Yes.
Can you hear me?
Yes, please.
Oh, hello. Good evening.
Good evening.
My name is Dr. Somba. I just want to ask a question to Judy and maybe Lisa. What is the role of the grandparents and maybe the whole social network of brothers, cousins, and so on, but more so the grandparents of the children in this kind of era or any stress? Because Africa set up, sometimes the grandparents they used to play a very important role, bring up the children and also to allay the fears and things like that. Is there any role that we expect the grandpas to play and grandmas in this situation?
Go ahead, Jude.
Yeah.
Hello. Do you get my question?
Yeah,
Yes.
I think Liz, you can make a stab at it and then we see what.
Okay, I agree. Grandparents have a very important role in our community. Grandparents have so much information, so much information on they're the ones who actually taught the parents how to parent, and they have stories and they have they're a great resource for the children growing up. Now, in our current situation, it is very dependent actually on where the child is growing up and how accessible the grandparent is to that child. So if the grandparent is accessible, I would want to say that it would be quite a waste if the parents did not access this child to their grandparents. There's a different kind of love also that grandparents give that the parents don't give. So I definitely believe the grandparents, the child should have access to their grandparents. But as I said, we do realize that if, say, a family lives in Nairobi and the grandparents live in Nyanza or in Western somewhere or in Kisii or even in Nyeri, it can become a bit difficult. And now currently in the era of COVID, I mean, this is even more restrictive for children. So I think that is my take. Maybe someone else, Prof?
No, I think what I would add, Dr. Somba, is that one, what Lisa said is absolutely true. And even in the era of COVID, we have these gadgets that we are using right now. And if they are accessible to them, they can use them and make the children happy. Children love talking to their grandparents, and make it a regular occurrence. Every evening we'll be having a chat with grandpa. That helps to reduce anxiety and makes everybody, even for the grandparents themselves, they feel better when they see their grandchildren and their families are doing well. I would expand that further and say that your entire social network, your entire family, you can recruit that network to provide a safety net for you for when things are not going very well. The child has a different relationship from the parent with an older sibling, and perhaps with a cousin, with an aunt, with an uncle, and with a grandparent. So if those are accessible and available, use them as well to allay the fears, allay anxieties, and help you to manage some of the behavioral problems that might start emerging in the context of these restrictions, because you will see quite a lot of that in children who are anxious, but they do not have the language to express it.
Correct. Just one last follow-up on this issue. I was going to try to think out of the box. The issue, like, children are very important people, and they were delicate. A lot of times that we find even the parents themselves, they have no know-how how to bring up the children, because all trial and error. We don't know. Now I was asking loudly, is there a way we can set up a parenting college? A college that, because you have, as somebody was saying, you buy a car, it has all the necessary use and so on and whatnot. But when you have a child and you also have a child yourself, you are stressed, is there a way that we can have a college or something that can be, I want to go and learn how to bring up a child. I want to go and learn how to bring up a girl's child or something like that. I know we respond when we have problems. The psychologists and the people like that, we talk to them. But initially, is there a way we can just get the basics? We're going to have a baby, and we want to learn how to do parenting of these children when they come. It's something that I've been thinking. As we go, as we move forward, something like that should be available for the young parents, not just get a story from their grandparents or friends or the church, or even a college of some kind. I want to learn how to bring up a child. I want to be told how to parent, because parenting is a whole big business. And for some of us, we have, and it's very complicated. Let me be honest with that way. So, so I really don't know, but just trying to think aloud, because there are college of all kind of things. But
we can help you, Tomba.
Yes.
And
so just thinking like that.
Liz, you can speak to this.
Yes. Currently, actually, we do have a lot of parenting. Not a lot, but they are not a college. I haven't heard of a college just yet, but I know that we have parenting sessions. Like I have held several parenting sessions. Sometimes the schools will call us, psychologists, to come and speak to the parents about different issues that they're finding. Maybe the child is not. The school feels the child is not being parented right, or there are some gaps. So the school usually will call us and we speak to the parents. Some parents actually take the initiative before problems set in, where children are now being oppositional or they're being defiant, and they come and they ask for a few parenting classes. So yes, that is a fantastic idea. Somebody should actually pick it up, or maybe one of the colleges should pick that up and offer support, because I agree with you, Dr. Somba. It's getting more and more difficult with the conflicting interests of most parents to parent properly. But I also think that here is where grandparents also come in quite handy, and grandparents are a good resource for parents to help them to help teach them how to parent their own children. Look at us here. We had parents who parented us, and here we are doctors, healthcare workers, etc., etc. So somebody must have done something right. So why don't we use the immediate resource that we have, and then look for other resources when we feel overwhelmed?
Yeah, I think, Dr. Somba, there are, as Lisa said, there are mental health professionals who help with parenting. But what I will say is that even though that is available, raising children cannot be manualized. You cannot make a manual on how to raise a child. The range of temperaments is just so much, and some are still evolving even as we speak, that you cannot write down and say, this is the pathway to raising a child in a particular way. And often, many who have tried to do that have found that they were wrong, because other people have done the exact opposite of what they have prescribed. And the people that were raised that way still turned out better than those that followed that manual. So this is perhaps the teaching in parenting classes, that there is no manual, and you adapt it to the temperament of the child, and you adapt it to your own values, you adapt it to the environment in which you're raising this child. So having a parent feel comfortable raising a child who they think is a problem child, but being comfortable handling that is one of the things that somebody can be empowered with. I do believe that those programs are there. They're not as many as one would like, but there are many people on this call who might take up that challenge, some young psychiatrists, young mental health professionals who might take up that challenge and run with it now in this diversified environment that we have.
So much, Prof, and for the questions, Dr. Somba. So I'd like to welcome our President, Dr. Kitulu, to kindly give us her comments on quarantine and isolation experience in children.
Thank you, Dr. Wairoto. And thank you, Liz and Judy, for such insightful presentations. Now, the last 1 month, I have been sitting at the National Coordination Center for the Quarantine and Isolation Facilities. And there's been, it's been really a deep end sort of experience where there was no chat and there was no direction, no clear strategy of how this ran, but we have run with it and come up with systems. Now, some of the experiences there have been actually quite challenging, especially where children are concerned. And I'll give two examples. In fact, one was from today. The mother is tested COVID positive. She's at Mbagathi, and the father and two children, twins, who are 3 years old, were in quarantine until they could be tested. So they were subsequently tested, and they are all positive. So in the time they've been in quarantine for 2-3 days, you can imagine mom was taken away and is somewhere else. And then they're here with dad in a new facility where they sort of can't understand. And now their results have come. How do we deal with that? The other family, I'll give an example, is from 2 weeks ago. So the mom tested COVID positive. She was taken into Nairobi Hospital. Her family was tested at home. She had 4 other children and her husband. Now, the husband, they had been advised, stay at home and wait until you're all tested, and then we'll know what happens next. So the husband steps out to buy food, and now, all neighbors have become very watchful. So the neighbors call the cops on him, and they say, he's supposed to be in his house and has stepped out. So he's taken into quarantine because he has violated the quarantine rule, self-quarantine rule. And 4 children are left at home, with the oldest being 17. Anyway, now when the tests come back, there's 2 of the children are positive and 2 are negative. So the 2 who are negative now can't be left at home because they are minors. And there's 2 who are now positive, who are supposed to go into isolation. So there we are now wondering, looking at this situation, how do we support? And of course, the first bit was, how do we bring the children with their mother and be at the same point with the mother? The logistics of which are all quite something else. So the logistics in itself was difficult, but that wasn't even my concern. My concern was, how do we support these children through this whole period? The quarantine period, those will be in isolation, and post that. I was already just looking at the separation from parents, the separation from dad, and then now you're told now you have to go into a new area. So the psychosocial support team, by the way, that has been working with us, Dr. Nasri Omar has been in charge with a whole team of psychologists, and they have done a brilliant job. Actually, a lot of what they've done has been online service, because it would have meant that they would have to PPE for all their interactions, with each of the patients who they were counseling. So they worked out a system of post-test, the results being released by the medics on site, and then they would do the online counseling. But for the children, of course, has remained a challenge, especially like where you have, where the parent now, the two parents were not there and the children were with their older siblings. So who are you telling the results? And then in terms of even how do you support the mother who doesn't know that her children are positive and now they are coming in to join her? So in that structure, I think this whole COVID experience, even the quarantine, the isolation bit, is going to create a whole lot of new challenges. I mean, Liz, I've seen what you presented in terms of the different reactions, but because this may go on for a while, how do we better support children in such areas so that the repercussions are not worse than, for anyone being put in isolation is difficult, but for the children going beyond this, and even their parents, you can imagine how difficult it is. So I'm bringing it to you as a challenge. You're the mental health experts. Share your insights so that maybe we can support these teams better and probably plug into the teams to support the children in isolation and quarantine. Thanks. Anyone can say anything, Liz, Judy?
I think I'll hand it over to Prof.
You've taken the easy way out.
I know, no, that's quite a challenge. As you spoke, I thought about 100 different permutations on how this could go wrong, and it's just horrifying. I think a lot of what we are going to eventually recommend for scenarios such as those will depend on what we learn about the severity of the disease in different categories. There might be a point at which we might say that if a parent of a very, very, very young child or breastfeeding baby, for instance, got diagnosed, if there's something that can be done to ensure she can continue breastfeeding the baby while she gets treatment, that might be the 100% best way out. But we don't know enough at the moment for us to make any kind of recommendation. And in my view, we are going to keep learning from how we manage the cases that you have indicated. The best environment in which a child can be taken care of is with the parent. So everything that is done should ensure that the children are as close as possible to their parents. Even if they are going to a treatment facility, I would say that they should be as close as possible to their parents. What we do with the young children who are negative, we might have, if there's no other relative available to take care of them in the period when the parents are being treated, we might have to think about having them in a facility close to the parents where they can speak to the parents while other people take care of them. So they might be considered as part of the people who are affected by this illness, even if they're not infected. Those are just my quick thoughts at the moment. I can tell you that the thinking will continue to evolve, and we might not reach a place where we have hard and fast rules and we have to apply it case by case. Judy, you want to add something?
Oh, sure. I think as she was talking about what step by step, what happened, I'm thinking again of different scenarios from the trauma that these children went through when they're, of course, you can imagine the neighbors have reported, everyone has come out, and there goes the father, who was now their social support. and then they're left alone. So I think, first of all, the way we are introducing a lot of stigma in the way we handle a lot of this. And these children already being separated, there is stigma into it. So I will say a heads up, I'll say correct, I'll applaud that the team that was involved actually did bring in psychologists to work with the children to address issues from the trauma through it all and the anxiety and reassurance. And of course, for them, work with social support. Someone just asked about grandparents. So we're talking about now external social support other than just the biological parents. So we have to think outside, the carers and all that. And unfortunately, stigma has brought it upon them that a few will be willing to take them up because of what they've seen happens. So I think also the policies that we're putting in place and handling how someone who is positive vis-a-vis who's negative, and how the approach and the approaches themselves are stigmatizing and traumatizing in themselves, and now throwing the isolation that is when someone is yanked away from their parents. So I'm hoping that even in all these protocols that we are coming up with, we have to have mental health practitioners involved, whether it's during the time when you're picking up the person who is supposedly infected or not infected, explain to them what is going to happen the next step. Many people don't even know what's happening the next step or where they're being taken. They just find themselves somewhere. So we have to involve a lot of mental health practitioners in all this. And hopefully with just what we've highlighted with Liz, that there's some awareness now that's being created that the impact of COVID-19 is not just respiratory. It cuts across beyond, yeah. So psychological support really has to be involved in all the processes, from taking up the patient to taking them to isolation or to quarantine or to treatment. That has to be there in itself.
Yeah. I think I'm going to even add, thank you, Judy, for raising this, that the process of processing people who are suspected to have had contact with COVID-19 needs to maintain a humane health focus rather than this security angle that has been brought in, where now police are the ones who are picking up people and taking them to quarantine. And that makes it a criminal justice problem, that you have been arrested by police and then you're being taken to quarantine. It is a bit difficult for the average person to process. So we have to maintain the focus that we are dealing with somebody whom we are trying to help rather than punishing. And if with that approach, I think they would not have done what they did of quickly taking the father away without thinking about the implications on the family. They would have allowed the father to participate in decision-making around what happens to the children, and perhaps to reassure the children that everything is fine and so is going to be responsible for you while I'm away, and so on and so forth. But then when you involve the police, they do not have the necessary skills or knowledge to do any of that. So that is, I think, something that we need to keep working at. The clinicians who are involved in diagnosis and in breaking the news to the people, they need to be trained, in my view, on how to break this news so that they're not breaking a death sentence. They're just informing somebody of a diagnosis and discussing next steps, rather than you got it. Now you're finished. You have to be taken away very quickly. Everybody else around you should not even be close to you. So that creates an environment in which even I would be very reluctant to be associated with this condition. So we have to start thinking around what are the implications of the policies that we are making on the population. Sometimes it might be better, like for that family, in my view, some of the damage that is caused means that it might have been better to leave them alone in their house with the virus. And the long-term effects might have been less than the effects that these children are going to suffer in future because of what has happened. So that is how bad it can get, and we have to be mindful of that.
So thank you, Prof. and Judy, and in terms of your feedback on that. And actually, some of the good news that I'll give is that incorporating the police force, we found they have over 120 counselors and psychologists on the police force. And that's a team that's being incorporated into the whole process, so that you can have those who understand how to break news and how to support people through this challenging time. So indeed, I think, as I said, this was a learning curve. It's not a situation that anyone had dealt with, but some of these experiences, I think, will make the whole process richer in terms of ensuring we have the right people in place to support, especially children. I think for me, I think as a mother, the issue of the children just totally broke my heart, and I took it upon myself to make sure, and there was a lot of good support actually, even from Bagathi Hospital, from Dr. Loisa Cheng. When I told her the mother is there and their children on this side, she made sure that the children then could be with the mother, because there's a male and female side, make sure that the girls could be with their mom, and the boy, at least even if he was on the other side, he could have time to interact as family. So I think beyond the written down rules there, as you said, it's a humane approach. We have to think outside the box and make some things practicable, even in the situation as it is. Yeah. Thanks.
Thank you, President. I have 2 questions for Dr. Dorcas Super. So the first question is, how do you manage severe pain, headache, abdominal pain, muscle pain in a 10-year-old? Then the second question is, for the children with special needs and in special circumstances, in view of COVID, what would you advise our colleagues to do?
Okay, thank you very much, Dr. David. And thank you to the speakers today, Dr. Judy, Kamau, and Liz, Judy, my classmate there, and the very beautiful presentations. And I particularly like this discussion because children, I interact with children a lot on my day-to-day. And just as in the presentation from both Dr. Judy and from Liz about the different presentations of based on the various groups, you see symptoms like severe pain, either it's headache, abdominal pain, are actually quite common for this age group. But one of the things that I would say is at this moment, I think part of the stress is how do I stay healthy as a parent, and also the child, how do they remain healthy? And we have seen how many parents would become anxious about any physical complaint from a child, and they may not be sure whether is this real, is the child just faking the symptoms or not. But one of the things I need to point out before I go into the management is one, do not dismiss a child's physical complaints, because they could actually be real. And what we advise is listen to the child, and then after that you need to consult with your doctor, your primary doctor, and if possible you can consult with your pediatrician and see whether are these physical complaints or are they manifestations of the stress that has been discussed previously. And in terms of management, we have seen some children would actually have symptomatic migraine headaches. They could have cluster headaches, they can have tension headaches. Abdominal pain is a common symptom, although maybe for the age that is a little younger than the 10-year-old. Muscle and especially maybe chest pain could come in, and it could be a number of diagnoses. They could be having asthma, especially for asthmatics at this age. They could present with a chest pain, they have breathlessness. And so in terms of how to manage, one of the things we do, of course, is assess and see, is this physical pain, is it present or not? And pain is just a perception. So you want to see to what extent is this pain interfering with normal function of the child, and how frequent is it? And then does it respond to medical treatment like pain analgesia that you can give to the child, and to what level? So one, for a parent, they need to assess, is this a new symptom, or has it been there and now it's becoming worse over this period of COVID? And that could perhaps indicate it could be an anxiety that is raising this sensation of pain. The other thing would be, if it is a new symptom, it could actually be a disease, physical, or it could be the new symptoms of anxiety that may be expressed in the child. And therefore, a consultation with the doctor or any other health provider would be able to manage this. Now, if I move to the question about children in special circumstances, one of the things that we have seen during pandemics and during disaster, we have children who go through conflicts and all special circumstances. These are children who are usually vulnerable to not only the mental disabilities, but also even physical. And one of the important things is their nutrition status, as has been discussed. And special care needs to be taken to children with special needs, like what has been mentioned, like the autistic, ADHD. We have children with cerebral palsy. We have children with mental retardation. They are highly dependent on the adults or the other caregiver that is within their environment. And during circumstances like this, where there is increased anxiety, uncertainties, it may have an impact on their physical well-being as much as it does on their mental health. And therefore, special care needs to be given to such children. Now, there are those who are in special circumstances. We have children who are in institutions because either they are orphaned for one reason or another, either orphaned because of disease, or they could be orphaned because of issues with security reasons. And we have some of them, and quite a number in our country, who are in institutions. And they're not only facing the uncertainty of they're not in a family. The other thing is they don't know what this pandemic would bring about. And we know the government has a program to bring alternative family care for these children. But again, we also have those already in adoptive families who may now face the uncertainty of will my adopted parents, will I lose them again? Will I be taken back to the institution when I lose these parents because of COVID? So there's that fear of losing parents twice. And for those who have their parents, they may be afraid that they might lose their biological parents and therefore become vulnerable and might be put in other circumstances. And of course, at this point, in just the case that Dr. Kitulu has mentioned, where parents were taken away, you know, such a family, the children would be afraid, what if my parents go into the institutions and they die? What will they do? What will that have an impact on them? And that is on the mental health as well as on their physical well-being. And one of the things that is of concern is the nutrition status for us as pediatricians and health practitioners, is that we have seen some of them may refuse to eat and others may overeat. So their nutrition status is really at risk. But the advice that we give is this is the best time to advise parents to make and reinforce the message of healthy food options and healthy food choices that they need to make, so that then they are not vulnerable to some of the consequences of poor nutrition. Then the other thing, of course, that we emphasize is that good nutrition will definitely promote their health, but it will prevent infections. And by preventing infections, therefore, they stay healthy. So it's one of the messages that we can give to parents to be able to talk with their children, so that as they stay at home, they are eating and staying healthy. Then the other thing is about cognitive development. So this COVID, one of the things that school does is, of course, to provide education, which in essence will help them in their cognitive development, but especially for the younger children. Why do we encourage play in the homes? we want them to identify play activities that are going to help in cognitive development. And so you're not just doing any kind of play, as long as you're there as a family. So the challenge, of course, is to families that have various age groups. But even with this, the parents need to identify the activities that are age appropriate, so that then you ensure that all the children are developing well. So this play is not only for mental health promotion, but it also helps in their cognitive development over the years. And of course, the children, I mean, in their period, especially the first 3 years of life, that's where we have maximum brain development. And therefore, this is very important. And a good environment promotes that healthy development. So for the ones who are in special circumstances, this becomes even more difficult. We are actually in a special circumstance because it's a pandemic that is facing each one of us. And therefore, we need to look at those areas, our nutrition status of the children, looking at their cognitive development by making sure that they are engaging in activities that they promote their brain development and also promote their staying healthy. And the last thing I would mention, of course, is a vaccination. And we know that during this period, a lot of parents may skip appointments for vaccine, and yet we are trying to deal with an infectious disease. So an emphasis should go to the entire country that parents need to make sure that they take their children for their immunization, because this is a very effective preventive measure for infectious diseases. And if we are able to do that, then at least let's reassure the children that they will stay healthy, but identify any symptom that you think is not usual and it's a new symptom. Always consult and make sure that the child does not remain with any suffering, physical suffering. So I think that's what I would add to the discussion. Thank you, David.
Thank you so much, Dr. Dorcas, for answering the questions very well. I'll hand over now to Dr. Catherine Gitao to take over. Dr. Gitao.
Great. All right. I hope it's okay if I speak with without you seeing my face. We've had a great discussion. Can you all hear me? I hope so. Okay. So
yes, we can, Catherine.
Okay. Thank you so much to our speakers for today. We've really enjoyed listening to what you had for us today. And thank you, Dr. Kitulu, for bringing out your experience at the quarantine centers. And that has left me with so many questions. I hope we can follow up that discussion in another webinar. So thank you, Dr. Kamau. You really brought out quite a number of issues, the sources of vulnerability in adolescents to mental health issues, the manifestations of stress, and some of the reasons why there's exacerbation of mental disorders in our adolescents. And we appreciate Dr. Liz for bringing out quite a number of issues on management strategies. And I can't break down everything right now because then we'll be here the whole evening. We have learned so much. And I also thank the pediatrician who has spoken to us, and I'm taking home quite a number of things that going forward, we need to pay a lot of attention to the health of our children, helping them come up with routines while they are home, managing their nutrition, and quite a number of important things that have been discussed this evening. So this is just to thank all the panelists, thank all the attendees to this meeting, and especially thank the speakers for today. Prof. Atwoli, you have been quite resourceful. We thank you very much for having attended this meeting. Thanks, Dr. Somba. for the very interesting question you asked. If there can be parental school, I hope we can have that school like yesterday, so that we can all go and attend school where we can learn how to parent. So so the next meeting will be next week, starting at 6:30 again. There'll be a webinar, and the topic for that day will be stress, distressed, or depressed. Understanding the difference and knowing when to seek help. And our speaker for that day is our consultant psychiatrist, consultant psychiatrist, Dr. Edith Kwoba, who is the head of mental health at MTRH Eldoret. And we really look forward to understanding what the differences are between stress, distress, and depression. So look forward to seeing you again next week, and God bless you and stay safe. Thank you.
Thank you very much, and bye-bye. Have a good evening.
Thank you. Bye-bye, everyone.
Bye. Thanks.